Community Regional is making use of what's known as an instrumental swallow study to help improve quality of life for patients who have difficulty eating or drinking. The program is known as FEES, Fiber Optic Endoscopic Evaluation of Swallowing. Susana Rodriguez, a speech-language pathologist and FEES program head, sat down to tell us how it works.
We started with our very first FEES procedure in the ICU in January of 2016. Since then, it took about a year of just solely doing ICU patients. And then we moved out and launched out to the floors in fall of 2017. So during that time, we've seen quite a few patients that are in the ICU that truly benefit from having this type of procedure done, because there are many times in which we didn't have this procedure and that patient couldn't have an instrumental done, whether there's quite of a complex case in which moving them out of their room is problematic, or getting that coordinated is extremely difficult. So whenever you're suspecting difficulties with positioning, someone who's on a ventilator and would require the use of having a respiratory therapist and a nurse and transport. Whenever we're suspecting that there might be some alterations to the anatomy because they were intubated for a long time, or their voice just doesn't sound normal. Anytime we suspect that there's quite a buildup of their own secretions and we don't really know how well they're managing that, it's best to view that from an endoscopy, because you get to visualize that directly with the scope, versus doing an x-ray in which you don't get to see that visual just isn't there on an x-ray. Either they would go to a video swallow study in which we take them down to an x-ray and they would drink barium, and that's how we would view their swallowing in that aspect. Or you can do this sort of instrumental swallowing assessment where we bring the machine at bedside. We use a video endoscope, and we would put the endoscope in through the nose, and we get a good view of what it looks like in their throat. We get to see their vocal folds or their voice box. We get to see the actual movement, the anatomy and physiology, and we get to look at the swallow as it's occurring and whether or not the food or liquid that we're giving the patient is going into their airway, or what we call it penetration or aspiration. We get to find out where the abnormalities are, the impairments. We can guide treatment around that. We would also be able to determine their safest diet. Being able to bring this machine at bedside and perform this procedure, you're talking about someone who wouldn't otherwise be able to eat, or we were just using our clinical judgment at bedside to decide whether someone was able to eat, but not really knowing concretely what was happening with the swallow itself. So using this type of procedure, identifying that early on in their process, we were able to start them on diet sooner, and they finally get to enjoy the benefits of eating and drinking again, which they hadn't been doing since they were admitted into the hospital.